Hi guys, Dave Man Max, and we are back with Dr. Rand for Ask the Doc. It's your favorite series, you guys. So Doc, welcome back to the show.
Nice to be back.
New offices, I see.
Still barren yet, but new offices.
We'll give you guys a tour in a few weeks when it's finally finished completely. But Dr. Rand, we got some good questions, so we're going to get right back at it. I want you to start with number one, and it's from France, actually, all the way from France. So go ahead, Doc, take it away.
I'll read. Okay, sure. Hi, doctor. I'm a French bodybuilder. I'm 27 years old, 250 pounds, for 6'1", and around 13% body fat. I always try to keep my health as good as possible since I started bodybuilding 10 years ago. I tend to be more and more sensible to my health as I get older and try to learn every day. I think I'll need your service to have the safest bodybuilding approach and still put some quality muscle too. I decided to stop all 19 NOR months ago, even if it was low doses. I also took health subs, ubiquinol, MK, I guess that's MK677, krill oil, choline, N-acetylcysteine, astragalus, garlic, and I've always had my blood works in check. All is okay, by the way, except liver enzymes after an oral take with my cycle, very methylated. At the moment, I'm on moderate dose of test, 400 milligrams and 800 milligrams of Primo.
That's a lot.
And I cruise more than before, TRT dose. I never paid attention to my BP since it was pretty normal, even on trend, etc. But at the moment, I pay more attention on it, and it's elevated but not stable. Right arm, 155/50. 3 minutes after, 147/65. Left arm, 120/60. My heart rate is high too, around 90 beats per minute. I don't like it. I want my heart healthier. I went to a cardiologist. He didn't see anything abnormal except a slight left ventricular hypertrophy. I started to increase cardio, but I didn't do often, to be honest. Low intensity, like, I don't know what LISS stands for.
I don't know.
What are your thoughts? Thanks a lot. Well, again, I'm not supposed to practice medicine over the internet, so please take all this with just a grain of salt, which really, this is totally curbside service. But I do have a couple comments that I think are applicable no matter what. Moderate dose of test, that's a bodybuilder dose, we would say, a supra-physiological dose to get to 400 milligrams per week. 800 milligrams of primobolan, though, that's a really high dose, and this comes up a lot. I don't know if I've touched on this before, but the idea is sometimes put out there that this mug, whether it contains a glass of beer or Wild Turkey 101, is the same in effect, or whatever you want to call it. That's the problem that I see a lot when guys are comparing anabolic steroids or any sort of drugs, oftentimes, or even supplements. Anavar was made by G.D. Searle way back when, and it was made in 2.5 milligram tabs.
That's right.
The highest milligram dose I believe they've ever produced is 10 milligrams, because for a guy anywhere 10 milligrams twice a day is actually considered the bottom of the replacement dose, and maybe 20 and 20 would be the top of the replacement dose. 2.5 milligrams goes a long way. And so, I've heard of guys taking 100 milligrams of Anavar, and they come in after 4 days of doing something like this and say, gosh, doc, I want to tell you, I'm doing this, I'm getting these capsules, underground somewhere, and I'm taking 100 milligrams a day, and I'm sweating, I'm really anxious. Well, yeah, you're taking 100 milligrams of Anavar. I think you get the point.
Yeah.
100 milligrams of primobolan is, I think, what it typically comes in, or it used to come in when it was not considered contraband, and it was made by the German company. I'm drawing a blank here. And that's a lot.
Yeah.
100 milligrams of primobolan a week would go a long way. 800 milligrams of primobolan, that might be why your heart rate is so high. It might be why your stroke volume is apparently high, or there's some reason for the disparity between the systolic and the diastolic. Some of these numbers don't look like they could even be possible, like the 155/50, that's suspect. That's an awfully low diastolic, and that's a very wide pulse pressure, and that can be from any number of things. Workouts can make for a wide pulse pressure while you're working out, but sitting in a cardiologist's office, we shouldn't see this. So, I hope there's there aren't some issues with like aortic elasticity or a lack thereof that would cause that, or pain can cause that, but that's sort of the same effect as you would get when you're working out. You've created a higher pulse pressure. We call it again that spread. Now, the difference between the right arm and the left arm, that could also be an issue. What's interesting though is, again, quite clearly he states here he's been to see a cardiologist and he didn't see anything abnormal except for some left ventricular hypertrophy, which is normal in an athlete.
Right.
Particularly a weightlifter and someone who's been weightlifting most likely fairly heavily with heavy weights for 10 years. And certainly, with the aid of some anabolic steroid, which is increasing the muscle mass of the heart. So if it's slight, that's what we see in a lot of athletes, and there's really no worry there. I mean, just sort of a side note, if you're going to increase cardio, you may not lose the left ventricular hypertrophy, but you can still reshape the heart, which it's just different when you're using your heart for cardiovascular activity versus weightlifting. Either way, you can still have more ventricular hypertrophy. Left ventricular hypertrophy is very common in athletes because that's the last place the heart the last place that the blood is in the heart before it leaves the heart. So that's where it gets its last impetus to go through the rest of the body. So that's where it's going to be typically the most muscular, certainly for athletic reasons. We can have other parts of the heart that have hypertrophy, but they're almost invariably bad reasons. Left ventricular hypertrophy can be from hypertension, and the heart's having to work too hard to pump against the pressure, if you will. In this case, again, it sounds like it's what we would refer to as an athletic heart. It's slight, etc. And then I don't want you to read too much of this. I'm just sort of spitting it back out and giving you my interpretation. But to have a difference between the two sides is something to look into. I'm not sure why the cardiologist, or what he did to say everything's okay despite these differences, because that is pretty different. 120 over 60 versus 147 over 65. It could be, and I've seen this before, it's not necessarily a blockage. Sometimes you're worried about you have some plaque or a thrombus of some sort, maybe on one side versus the other. But I've also seen it vary because of just muscle tightness in bodybuilders, guys who don't stretch enough, or have too much scar tissue or just adhesion. So anyway, I would definitely maybe consider, my best advice, maybe consider another cardiologist's opinion, just to be sure that all this gets explained. And what's the problem with doing too many anabolics for too long? Any anabolic steroid is going to affect your lipid profile. Period. End of discussion. We know that Winstrol or stanozolol is going to do that much more so, like cut it in half within 3 days than some of the others. Maybe like a Nor19, like Decaduroblin or Nandrolone. And of course the orals are going to probably do that more than the injectables. But if you're trying to work on heart health, I would definitely cut back on the dose and maybe even consider dropping the anabolics, just because, look, when I'm seeing these labs and guys are coming in here and saying, well, my HDL's at 22, but I'm also, taking some oral Anavar or whatever, some anabolic steroid. It's great that I know why, because we want to find out why. Is it pathological, or, okay, you're taking some oral anabolics. But, and so the thinking is, well, it's temporary, it's not pathological, don't worry about it. But if you think about it, if you're doing that consistently, then it really is, in a sense, pathological. If you never let your body re-regulate itself and stop the process. And why do we care about that? The whole thing about HDL is scavenging. If it's not, I can think of a better word, I guess, at some point. But it's bringing the cholesterol back to the liver rather than LDL, which tends to go out and deposit in the arteries. So it's a good thing. And you want it to be in a ratio that's a good thing. High HDL relative to LDL. although that's higher HDL and lower LDL.
Yeah.
That's what I mean to say. So if you are doing something, even though it's not pathological, for a long time, it can become that, I guess is what I'm trying to say and get across. So yeah, take a break. Take a break for your heart health. And maybe let some of the left ventricular hypertrophy subside, maybe not. But for some reason, that pulse pressure is high, and that would bug me. I'd want to maybe do a little more investigating to see why. There could be some valvular leaks, which would make for a need for the heart to come up with a greater stroke volume to compensate for the valves not working. Anyway, that's more for a cardiologist. But I think I hit everything there. And some of the supplements, I mean, ubiquinol is going to help with heart contractions. That's coenzyme Q10 in one of its forms. The krill oil is great because of the omega-3s, which will help boost up the HDLs. Certainly doing cardio will be good for you. Garlic, yeah, that's a good one. And then the liver enzymes, well, we've talked about one of the great things for liver enzymes. Typically they're elevated in someone who's taken anabolics because of deposits of glycogen in the liver, excessive deposits, because after we deposit in the muscle, it goes up to the liver. So maybe a good month of high-dose choline and inositol, 3,000 milligrams each a day, and you could throw in some L-methionine, 1,500 milligrams a day for a full month. Other than that, I think we got his questions, right?
Yep.
Okay.
Awesome. Thanks, Doc.